Hello, everyone. Our topic for today is how the mental health of Israelis changed in the wake of October 7th and the war that came after that. Our special guest today is Dr. Yuval Neria of Columbia University, who's one of the world's leading experts on the effect of trauma on emotional health and mental health. We're going to hear from him two things. We're going to hear about the data about how the mental health has changed. And then we're going to hear from him about a very important initiative that he's one of the leaders of to help Israel respond to that. But please, first of all, Yuval, please say hello to our guests and tell them a bit about yourself.
Hello, happy to be here. My name is Yuval Neria, and I'm a clinical psychologist, professor of clinical medical psychology at Columbia University Department of Psychiatry and Department of Epidemiology, and also a research scientist at the New York State Psychiatric Institute.
Okay, that's great. Please share with us some of what you know about how the mental health of Israelis changed in the wake of October 7th.
So I've been involved in post-October 7 research basically from the start. I was invited to visit Israel a couple of days after October 7, spent a few days at Hotel Yam Suf at Eilat with really hundreds of evacuees from Nir Oz and other kibbutzim in the Otef Aza, and later on was involved in Homiya project Homiya, which is a very nice initiative aiming to address some of the major gaps in the mental health system in Israel. So I've kind of developed a good idea about what is really missing and how to address it. Let's talk a little bit, Bruce, about what the data is telling us, and if it's okay, I would like to present some of the data on slides. So let me just share my slides, and this is really a very nice study that was led by Professor Yossi Levy-Belz from Rupin College and his team, which I was part of, presenting a very dramatic jump in PTSD, depression, and anxiety following the terrorist attack of October 7. And as you can see here, this is PTSD before the attack, August 2023, about 16% levels of PTSD jumping to almost double to about 30% in November 23. We can see similar trend with depression, big jump, almost towards 50%, and a little bit less of that in GAD, general anxiety disorder. And this is really data that was taken from about 700 Israeli citizens, really a representative sample. What we also found here is that direct exposure to the attacks increased the risk for PTSD almost by threefolds, and almost by twofolds in depression. So you can see really a dramatic rise in risk of significant and quite disabled psychopathology among Israeli residents. And if you want to zoom on the Arab population and to contrast the Arab population in black to the Jewish population in gray, in all three measures of PTSD, depression, and anxiety, you can see really shocking differences between the two. While levels of PTSD is only about 25% in the Jewish population, this is rising to more than 50%, both double, compared to the Jewish population, but actually rising to more than 50% at the Arab population, 57% of the PTSD, while we see 57%, almost 60% of the Arabs demonstrate a risk for depression, major depressive disorders, and about 50% levels of anxiety disorders. And this is really, I would say, pretty shocking data indicating very early on, after the October 7th, that there will be a lot of work that should be done in Israel moving forward.
That's really important and actually, for me, a little bit surprising. We usually think of the impact on the Jewish population, and you're showing even bigger impact on the Arab population. Do you have any thoughts on why that might have happened?
So what we know from literature around the world is that minorities are always at higher risk for mental health problems following trauma exposure. Minorities can be Hispanic and Blacks in the US, and also Chinese populations. And in Israel, minorities are usually Arabs. Arabs can be Muslims, Christians, Druze, Bedouins. But overall, we see significant risk among this population. And this is really, I wouldn't call it paradoxical, but at least very curious, because the aggressors on October 7 were Palestinians at the Gaza area, from the Hamas movement, terrorist movement, really attacking Israel and especially Israeli citizens at the south and Israeli soldiers. Nevertheless, the Arab population that was usually not directly exposed to the attacks probably experienced a lot of fear, um, uncertainty, was seriously traumatized, and eventually, showing that there is really a big gap between the two populations, or a big difference between the two populations. And as you know, despite the fact that those are Israeli citizens, nevertheless, the amount of resources in terms of mental health services, particularly at the Galilee, at areas that are kind of outside of Tel Aviv, kind of lacking mental health resources that are at this point were highly needed in order to address this need. Yeah.
Very important. Now, going back to the overall population, I think another thing that's very interesting about the study is not just that people in the impacted peripheral areas, it's a representative sample. It's, of course, from right after October, or pretty close to the October 7th. More than a year and a half has passed since then. What can you tell us about the extent to which mental health has gone back to the pre-war levels?
Well, first of all, this is a very important question. What I've shown to you is data from really early stages after the attack. Since then, there is a war going on with no end, foreseen end, unfortunately, that involved hundreds of thousands of Israelis that are going into Miluim and need to leave work and family and education, studies, universities, colleges. So the level of burden is also only increasing in the Israeli population. And you can see some of the communities, both in the south and in the north, have yet came back to their moshavim, kibbutzim, and small towns. Both in the north and in the south. The government is really very late in addressing the economical need, the employment needs of this population, and especially among kind of high-risk groups or subgroups in this population, youngers, people, especially children and adolescents, the elderly, those who have been reporting losing somebody on October 7, particularly families of hostages and communities where hostages were taken from are really showing up in masses with regard to their psychological needs, occupational needs, physical needs, medical needs. There is really kind of a widespread, I would say, ongoing and enduring crisis among certain groups in the Israeli population that deserve a lot of attention at this point.
Before you showed us data on levels, the prevalence of depression, anxiety, and PTSD shortly after the war, what has happened to those levels since then?
So what we have seen in recent studies is that there is some decline, not normalization, not returning to baseline, but some decline in levels of anxiety and PTSD, but very steady levels of depression among the Israeli population. And that's really, again, very, very interesting. As you know, PTSD and anxiety are kind of fear-related disorders. They are usually more related to the acute exposure, and depression has a tendency to be more lingering, suggesting issues like sleep problems, problems in concentration, kind of low self-esteem, low levels of functioning. Sometimes you see association with suicidal ideation and suicidal attempts really recently. So depression is really seems to be very prevalent at this point among large groups of the Israeli community and need to be addressed really sooner than later.
Right. Now, please tell us a little bit about to what extent Israel's mental health system was prepared, had enough people, had the right approaches before the war, and tell us about the work that you and others are doing to try to deal with this major increase in needs.
Right. So the mental health system of Israel is known to be suffer from a number of gaps. And if it's okay with you, Bruce, I can show you another slide on two about those gaps. Um, Certainly, there is there is really a concern that, as I said before, that the risk for long-term and yet to be addressed mental health problems will be lingering and long-term and can take this country perhaps, decades really to address. And it's not clear whether the termination of the war will kind of mitigate this concern. And, and this bring to the mental health system, especially the public mental health system, kind of massive demand for assessment, for interventions. Um, the field offer at this point numerous treatment approaches, all the way from group therapy and trips to India and yoga and even MDMA. But there is really a lack of using kind of briefer, more structured, known to be effective or efficacious treatments that that got a lot of support in the literature, and our group, the Homiya group that led by colleagues at Shalvata and colleagues at Columbia, like myself, um, uh, put together a program really to train as much as we can Israeli clinicians in evidence-based interventions for trauma, such as prolonged exposure, interpersonal treatment, um, training in pharmacotherapy that can be combined with those treatments. And particularly, we put a lot of emphasis on teaching Israeli clinicians really to assess, to diagnose better trauma exposed patients, and to think about what is really needed in terms of intervention for each person individually in order to provide care to the right people in the right time. Because time is really kind of a major concern now. We have been almost 2 years into this crisis, and if you don't address trauma-related problems like anxiety, depression, PTSD, substance abuse, eventually symptoms can be solidified, become chronic, resulting in increased comorbidity with physical problems, substance abuse, and suicidality. So timing is really an issue, and we know from many instances, such as 9/11, that addressing mental health needs in a timely manner can solve a lot of problems down the road.
For sure. Could I ask you to stop the share screen? That's great. So that's been very informative and also very inspiring. Before we wrap up, do you have any maybe one or two takeaway lessons, sentences, but we need to keep it short?
Well, I think the main lesson is to be very sensitive to the ongoing and changing needs over time. What we know from previous research is that levels of trauma-related psychopathology are changing over times, and each person has his or her own, individual needs that reflect those changes. So we need to be vigilant. We need to be attentive. We need to look at people as individuals in order to help them the best.
Good. Thank you very, very much.
Thank you, Bruce.